Hi, I'm Lynn's Peck, and I'm here today to give you some tips and kind of guide you a little bit how to change a colostomy bag. Today I'm not really gearing it towards the patient that's laying in the bed. I'm gearing it more to a person that's doing his own self-care and some little tips that you might give him that will help him be more successful at doing his own care. Before we begin, you should instruct your patients to always lay out everything that they need to keep them having to get up during the procedure. So to start out, you're going to make sure that you have adhesive remover, some type of way to cleanse the area if you have to add medications, all the things that you need to put the bag back on, which would be your stoma powder, your skin barriers. Make sure that you have your wafers, your scissors, the type of bag that you're using, something to measure, and maybe just some paper towels or the gauzes. Now before we begin today, I've got a few things that I kind of want to talk about for the bags. There's three different main types of bags. There's a bag that's just like my patient has on today. It's just a pill and stick. There's not a wafer with this one. But the thing about this one that's real nice is that this is like for on the go for short periods of time. And while I was doing some research, I found that a couple of long-term patients who were younger were taking and they were decorating their bags so that they could like even wear them on the outside of their bathing suits. And so all they did was they just got duct tape, which as you see it comes in all kinds of different colors. And a guy could even do this with camouflage because there was some camouflage. And all they did was they just cut little strips the width of the bag, put it on there. The only thing that you have to do is you have to be careful not to cover this little vent. So you just cut around it and make sure that it's still workable. And other than that, you're ready to go. It's waterproof, it's cute. It's kind of a good way to make it your personal bag. The other kind of bag is still kind of a pill and stick type thing. But it doesn't have a clip with it, and it still is hard to release. So I find that it's not as effective. The next bag that we have is one that has a clip and a wafer with a, so it's a two-piece. So this is a two-piece system. Even though the bags are basically three different kinds, there's different kinds of bags in each group. Like this one has a vent on it, so this is kind of geared for patients who have a lot of extra gas. The bags will have a tendency to blow up a lot so that they can deflate them without having to take the whole thing apart. So they can deflate, put the little vent back on, and they're ready to go. Now, when we're starting today, our patient has been using the pill and stick. And the first thing that I would do is I would use adhesive remover. I would avoid using alcohol because it's very drying and kind of tough to the skin. Adhesive remover is still a little bit tough, but it keeps the skin from tearing and breaking down. And we want to do anything possible to reduce the irritation and the red areas. So all I would do, I have another little tip, and there's a couple little tips that I wanted to do. I saw a lot of times they're in a standing position when they're changing their bags, and before they get ready, they would you could use a trash bag, and you could just put the trash bag in your underwear and maybe a small paper towel. That works. Or if you're doing a sitting position, you would take the towel. And this is the one I like because I don't mind washing them a little bit. But you know, not the best towels in your cupboard. But just take it, and all you're going to do is, again, you're going to like fold it over the top of your clothing so that when you do have the drippage and the leakage from the stool, it's not going to get on your clothes and you don't have to do a whole clothes change. Another thing that's very helpful before you start your care, and this reduces the peristalsis of the bowel. If a couple of the patients can use marshmallows, or they use peanut butter or gummy bears. It kind of depends on the patient's diet, what they can tolerate, And the other factor that goes into that, do they eat it immediately? Does it work for them if they eat it and then that slows it down? Do they need 20 minutes? Do they need 40 minutes? So each patient can try this trick and see if it helps them. They can vary the time, the amount. Usually it's just a couple. It doesn't take a whole lot. But what you're trying to do is you're trying to prevent the stool from just continually to ooze out while you're doing this change, because the more that stays in, the better it is for you. So what they do is you take your adhesive remover and you gently pull up around the skin, moving all the way around the stoma, and just try not to rip the skin until you go all the way around and you free it up. Then you would just drop it in your trash can, and that is an important part of the equipment so that you just can peel it, put it in. If you use the bag system, the garbage bag system, while you're standing, a lot of people just drop everything right in the bag. So they've got the bag for the stool if it comes out, for the trash that you've used, and it works for a lot of people. They like that. But I like this again. So we're going to get rid of that. Now we've got the adhesive remover off, and now we want to clean the area. And you know, this is not written in stone either. If this is an individual patient, they're not going to get a new bottle every time at the hospital. You know that you get a new bottle, but this is in home care. So you're just going to put a little bit of normal saline on the gauze, and you're going to clean from clean to dirty. So you would start on the outside and work your way in. Now when you get to the stoma, be sure not to rub the stoma. It is more of a pat, pick up situation. So this is a very sensitive, delicate area, so you want to be very gentle with it. So you wash it away a couple of times, one time, it depends on how clean it is. There's another cleaner that comes in a little packet. It's about the size of this, and it's called Niltac, Niltac, or Niltac. And it's a real good product, because what happens when you open the package, it's like a baby wipe. It's a little bit bigger, and you can clean the area with that. And it's made so that you can actually fold it in half and use it several times, so that one wipe usually can clean the area if it's not just extremely dirty, and throw it away. After we've got our area clean very quickly, in most cases, you would need to just take, this is a little trick that will help keep it clean. You take the gauze, you bend it in half, and you fold it, and you go around the stoma very gently, very close to it, and wrap it around. And the term that the little girl that I saw use this, she called it her volcano. And I am going to add another little part to it, because it doesn't always stay in place for me. I like to take a piece of tape and just kind of gently tape it, not where it's touching the skin, but it's on the gauze itself. And if you have an explosion or a blowout during this procedure because you're messing with the stoma, it'll kind of contain it a little bit more. So we have our volcano in place. Now we have the area opened, and so we want to examine the skin. This is a very important step, because if there's been any leaking or oozing, when the stool gets on the skin, it makes it very red, irritable. You can have yeast set up in there. You notice the little red bubbly areas. These are all prescriptions, but you would get some nice statin, and you would just kind of sprinkle it just on the area. So it's a little powder. And the thing about this is, again, you only want to put it in the areas that you see the redness. And if you have other breakdown, there's other products that, again, that can be prescribed by the doctor. Once you get it on there, and you don't want the heavy coat, because if you get too heavy a coat, you're not going to get this wafer to stick. There's a skin barrier that you apply. Some people are very, very adamant about applying the skin barrier. Some people are not. Some find it helps their wafer stick, some find that it doesn't. But the ones that do, there's also a product that's called SILESSE, and and this one is a no sting barrier, and they just come in little packages. Again, they're very convenient to use and to carry with you. And so you would again wipe around, trying not to avoid your if it's going to be under where the yeast is, you're going to have to apply it again, because I just kind of wiped that one off. So at that point I would let it dry. Again, put my little Niastat on there. And then I'm going to go to the stoma powder. Now the barrier and the stoma, the barrier and the stoma powder, they build up a bonding kind of agent for your wafer to stick. Now, a little secret that I take with me is if you get this on too thick, nothing's going to stick. Some people use a piece of gauze and they kind of dust it off. If you have problems getting your wafer to stick, you'll have to reduce this the volume that you use more. I like taking the brush because it seems to me that I can control the situation a little bit better. Okay, now we were going to let that dry and kind of prepare itself. And while I'm waiting for that, I'm going to get the wafer. Now, if you're used to cutting your wafer, you get this number down and kind of stays the same. But a stoma will change over time. They seem to get rounder as they've been in existence. Well, some of them do, some of them don't. But this is a kind of a gauge to see where you're going to start. This one would be, at this point, kind of look around. You're going to put the little volcano on after we do this again. But this one is kind of a standard size. So that kind of helps me go to, the companies give you different kind of measuring tools. Paper ones can be thrown away easily because the stool will get on them. So you kind of would move this. And what I want you to notice is when we cut this, we want to get it as close to the stoma as possible, but not on the stoma, because the wafer itself can make breakdown, but if you don't get it close enough, the stool will make breakdown. So you have to be careful that it has to be like almost a perfect balance. So this looks like it's going to be like 1.5. And so we're going to take our little pattern that we decided on. We'll place it on our wafer. And again, lots of times if the stoma had a little pooch in it, we would have drawn around that little area so that we would cut away in that area, and then we would transfer that pattern onto our wafer. And you just go around. I'm going to pretend like we have a little extra pooch on the side, and so it doesn't stay on the line. But when we cut, we want to cut on the line that we drew. Now there's regular scissors, and there are scissors that have a curve on them, and I much prefer the ones that have curves because it helps you keep a circular pattern as you're going. Now to save a little bit of time, I went ahead and cut ours out, and let me see if it fits. And so I'm going to take and place it over my, I like to have the little tabs on the outside. For me, it's easier to tear them off. And so I'm going to make sure that I'm not touching the stoma. It looks like I need to trim it just a bit more, because I don't want it to touch the stoma, but I don't want it to be too far away either. So we want to create that balance. Sorry about that. Let's see if that'll work for us any better. All right. It doesn't look like it's touching, and we'll have a little, could be just maybe a hair more. And this really is an important step, that you take your time and don't jump the gun. Don't get all in a hurry, because this is the important step that one, it's going to make sure that your pouch is going to stay in place and you don't have a lot of breakdown. So this is very important. I'm going to check it one more time. Looks pretty good. Okay. Now, just for, say this was, we might have had to put a new clean one on there now. Now, there's a couple of steps here that I want to review with you. You remove the covering from the wafer, and some people, they find that they like the paste. At this point, you would apply the paste around the outside, and it's gonna make kind of like a little dam. And so that if you do get overflow, it's not going to ooze underneath the wafer. It's going to make it a little bit more secure. But there's another product, and it's another little wafer. And you can cut off of the wafer, and then you take a little bit of it, and it's not going to work with gloves. But you take a little bit of it, and you roll into like a snake, and you get it into this little round circle. And then you can kind of place it on this. To me, this is a little bit more forgiving technique, and it works a little bit better. And you kind of just like get it on there, so it gives you an extra little sticky thing. And then we're going to take the pad, remove it, make sure that we don't have any stools. So you're going to use this to wipe up any little stool that's come out of there. Throw it away. Take the stickiness, keep it on the outside. And another little technique I like is if you bend it and kind of curl it up and then place it over the stoma so that you're working from the inside to the out. Make sure it's going to go straight right there. And you're going to press it around. You want it to go underneath the stoma, but at the same time you're working out so that it's nice and flat. The flatter the situation, and you're going to rub it so that it seals itself. And heat plays a big role in this wafer sticking because it likes to be heated, and the more that you can put your hands on there and kind of put your body heat on it, it'll seal a little bit better. After you get that part done, you're going to remove the sides. And it's better if you can get your stomach as flat as possible when you remove these tags, because that's where you're going to be walking, and it just makes the seal a little bit more effective. So, and at this point you kind of want to hurry because everything's clean. You want to make sure it doesn't get on the outside. But I'm going to take a second to explain. Before you hook it on, as you see, this has two little wings on it. These are important. These are so that the belt attaches to the, you can take your belt, which has been sized to you, and you're going to attach it on each side, and it makes it more secure. So the more active you are, it gives you a little bit more security so that you can feel a little bit more confident. I always like to start at the top, but if you as a person are doing it, you may start from the bottom, but you're just going to work it around, and you can feel it click into place. Or, I don't know if you heard it, but it kind of has a little click and a little pop. And so now it's on pretty good. Now I want show another little technique that this is called a squeegee. It's a bag squeegee, and this is for when you're emptying the stool. Let me see if I can get this. It has a long clip on it, and on each one of these clips you're going to put a piece of toilet paper on the top and on the bottom of your bag. So you have a piece of toilet paper on the top here, and if you're sitting on the toilet, you would take the squeegee, and when you're trying to clean your bag, you would push down, and it'll dump the contents into the toilet without really having to, push and tug and everything, and it kind of gives it it's kind of squeegees out the bag. There's another product that we want to add before we clip the end of the bag, and it's called Adapt. And this product, can you read? Yeah. This product does two things. It lubricates the inside of the bag, and it also is a deodorant. This is a pretty good product. Each one of these is maybe a little bit over a tablespoon I think would be closer. And what you do is you're going to put it all the way into the bag, and you're going to work it up all the way around. Now this is very good. It helps when the stool has a tendency to pancake. It will not let it stick so much to the bag, and you can get it out of the bag a lot easier. The next thing before you apply the clip is there's another little technique. is where you take it and you fold it in half like this, and you make a little crevice in the end of it. So when you get ready to open it and empty it, it doesn't stick to itself, and it will release it. Now, there's several ends to these. Some of the bags are like a fold. You like fold them 3 times, and they have like a little clip or a little Velcro in it, and it'll stay without that. This particular bag will be sealed with a clip, and I have like different sizes, different shapes, and they depend on the bag themselves. I like the one, if you can see, this one has a little curve on it, and so it kind of like goes with the body a little bit. And I'm left-handed, so to get started on mine is always backwards to me. So I'm going to roll it. It's that left-handed thing going again. And you're just going to clip it into position. Sure I am. Start again. There. And it's going to clip. Now at that point, you're going to take everything and you'll stick it back into there. You start cleaning up. You should have a nice little secure area, and everything can either go into the wash, what you haven't used goes into the trash. And I think that we pretty much have covered it today. So thank you for listening to me do all these little tips, and I hope they're helpful to someone. Thank you.